Remember back in the spring of 2020 when so much of the bi-state was shut down and there were closed signs everywhere you went? Well, a new scientific study showed all of that isolation we endured paid off and saved lives. Thanks for joining us. I'm Kay Quinn. Washington University researchers ran the numbers, and their models showed the early months of the pandemic would have been 7 times worse if it weren't for early action. Sarah Mackey's in studio with those details. And Sarah, what did you learn?
Okay, Dr. Elvin Geng says he first started thinking about this last year. Someone said they thought that it was clear local leaders had overreacted with the lockdowns, but he wanted to know what science said. So he looked at the numbers, ran them through all the models, and the results were dramatic. Now, St. Patrick's Day parades and 5K runs, those were some of the first events to be canceled last year. Organizers hoping that dispersing those crowds, sometimes thousands deep, would help with our case counts. And it turned out it did. By June 15th, there were just over 480 deaths in the St. Louis region from COVID. If local leaders had waited just 2 weeks to start their mitigation measures, this study shows the number would have been 7 times higher, more than 3,000. Event organizers say it was a hard decision at the time, but ultimately the right one.
We feel good. Like I said, we had a lot of questions at the time. We weren't sure what was going on, but we made a decision based on what we thought was the best information we had, and an abundance of caution too.
This analysis helps to show that, you know, if we're going to undertake these things, it's important to undertake them, I think, in a timely way.
Now, Geng says that they even ran some scenarios where, hypothetically, if we didn't see official changes, but a fourth of the population started social distancing and mask wearing on their own, well, they said if they did that, then the models show you didn't see the same benefits that we got in real life with our lockdowns.